This patient was referred to me for endodontic treatment of tooth number 8. Patient states that a few months ago, her dentist did a filling but told her that she might need a root canal. And a couple of weeks ago, patient started to have a lot of pain in the tooth and then suddenly swelling right above the tooth form. She went and saw her dentist, and from there was referred to us for examination of tooth number 8 and endodontic treatment if needed. So take a look here. All right, so that's the tooth here, and you can see a labial parialis, labial swelling associated with the tooth right there, and that's the tooth right there. All right. So we discussed options with the patient, and that's the tooth, as you can see right there. And there's a periapical lucency right there. Discuss options with the patient. Patient, of course, wanted to try to save the tooth. This is a young lady. So that's what we did today. She came in and we did this root canal for her in one appointment. And take a look. 24 millimeters was my working length. Apical diameter was 50, so this is white MTA. It's about 6 millimeters of white MTA, 6 or 7 millimeters of white MTA, followed by gutta perchance sealer. Again, we did this in one appointment, and the patient still had that labial swelling, but we were able to do this in one appointment because the canal was dry. Check the dryness of the canal with a sterile paper point, taken to the working length and inspect it. And as I said, this is white MTA followed by gutta perchance sealer. We temporize the tooth and refer the patient back to her dentist for the permanent restoration. Now, I do sectional in these cases, sectional rubber dam, and I put the clamp on tooth number 5. Tooth number 5 has a crown, and patient says, and I of course numb the tooth, but patient says, she overheard me telling my assistants to give me a premolar clamp for to clamp tooth number 5. And patient said, can you not clamp the tooth that has a crown on it? I said, why? She said, because that tooth's been bothering me. And I said, really? It's been bothering you? Okay, let me take a look. So the rubber dam, I had the rubber dam on tooth number 5 when the patient told me that. Okay, so take a look here. In fact, it wasn't tooth number 5, which is this tooth here. It was tooth number 4. All right, take a look. And look at that crack. So it was actually tooth number 4 and not tooth number 5. So we were able to document that and help patient out. So here with my Explorer, I'm pointing to the crack. You can see it starts from here all the way down. It's a horizontal fracture line. Starts from here in the mesial wall, extends up onto the occlusal surface, travels horizontally on the occlusal surface, and then goes down the distal wall. So this was a cracked tooth. Again, you can see it here. So you can see the decay, the mesial decay there, and then the crack right there. So I told the patient that, I said, it wasn't tooth number 5, so we clamped tooth number 5. I said it wasn't tooth number 5, it's actually tooth number 4, and I documented that into the patient's chart notes that the referring dentist will get, and the referring dentist will address this. Either this tooth will ultimately either need a root canal and a crown, or perhaps maybe the dentist will crown it first to see if a root canal could be avoided. But I'll let the dentist decide what they want to do. And usually in these situations, the dentist actually refers the patient back to me. But I rather we go the right route, referring the patient back, because this patient was referred to me for tooth number 8 only. So I documented all the issues associated with tooth number 4 in the patient's chart notes, and then the general dentist will decide either they want to tackle this themselves or they want to refer the patient back to me.